Greetings. My name is Ariel Gordon, and I'm the Promotions and Publicity Coordinator for University of Manitoba Press. Thank you so much for joining us for the virtual launch of COVID-19 in Manitoba, Public Policy Responses to the First Wave. Editors Andrea Rounce and Karine Levasseur will be joined by contributors Fletcher Baragar, Josée Lavoie, Stewart Hill, Shirley Thompson, and Julie Gard. Now, this event is being sponsored by the University of Manitoba's Institute for the Humanities. So I'm going to tell you a little bit about them. So the University of Manitoba Institute for the Humanities was established in 1990 to foster research and scholarship in the humanities at the University of Manitoba, to promote cross-disciplinary research in the humanities, and to help obtain external funding for humanities research. The Institute addresses the needs and interests of researchers in a broad range of subjects, including literature and languages, film and visual culture, philosophy, history and religion, and also the literary, philosophical, theological, and historical aspects of the social and physical sciences, mathematics, the arts, and professional studies. It also supports a graduate fellowship worth up to $5,000. The UMIH supports 2 or 3 research clusters and 2 or 3 research affiliates. The Institute is located within the Faculty of Arts, but is intended to serve the entire humanities constituency in the university and general community. And the Institute is generally, or is accordingly, committed to community outreach through programs and lecture series for the general public. And they're involved in a variety of interdisciplinary humanities-themed research initiatives. So we're grateful for their support. I'm going to share a link to that institute if you want to have a look. But the thing that I should do before we really get going is do our land acknowledgement. Now, I know we have people joining us from all over, but where I sit and where the University of Manitoba Press sits is on Treaty 1 territory, so that's where our land acknowledgement is based. So, the University of Manitoba Press is located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. U of M Press respects the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to moving forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. All right. So the last thing I want to do is normally during one of these events, we'd be sharing a link to the book. We'd be sharing a 30% off code. But today, the link is still there, but the book is free. It's a free ebook, so feel free to download it. Feel free to follow along. Another thing that I'd also be urging people to do normally, even in pre-pandemic times, is to support your independent bookstores. So you're getting this book for free. Maybe put the money you might have spent on a similar book and buy some books from independent booksellers. We really like McNally Robinson booksellers. They've been a real support for us over the years. We've had so many events there, and they're struggling to survive the pandemic. So, and what's nice is they'll ship everywhere across Canada. So, if you can support them this Christmas and holiday season, that would be lovely. All right. So with no further ado, I'm going to introduce the editors, and then they will take it away. Andrea Rounce is an associate professor at the Department of Political Studies at the University of Manitoba. And Karine Levasseur, I keep on saying, I know that I've been saying both Karine and Karine, so forgive me. Karine Levasseur is an associate professor in the Department of Political Studies at the University of Manitoba. Please welcome them.
Thank you so much, Ariel. I'm actually going to kick us off here tonight, and Andrea is going to be closing for us. And I just wanted to take a few moments as the co-editors to talk a little bit about the origins of this book, talk a little bit about why we're focusing on Wave 1 and why it's so important, and then talk a little bit about the chapters, because there are 27 of them, and that really does show the breadth and depth of scholarly and practitioner work here in Manitoba. So this really is a tribute to our authors for the hard work they did largely over the summer months. So to start off with, where did the origins of this book come from? Well, back in March, like probably many of you, Andrea, Rounce, and I, being associate professors in public administration, we often had numerous conversations, either by Zoom or by telephone, talking about how the pandemic was affecting us, how we could see the pandemic affecting other folks in our lives, in other regions of Manitoba. And we thought if we were having these conversations, most likely others were having these kinds of conversations too. And so we recognized fairly quickly that we needed to start documenting these experiences that Manitobans were going through, and also to identify the policy lessons learned or not learned, because we know this pandemic is not over. Right, there's talk of a vaccine, so we know that there is some hope, but today, we're still firmly in this. And so one of the challenges with traditional academic publishing is that it can take years to put out a book of that kind of quality. And so Andrea and I drew on our experiences from 2016 and 2019, where we worked with other editors, Dr. Royce Coop, Dr. Carol Ladner, Dr. Barry Ferguson, and had ebooks published within about 2 weeks of the two provincial elections. So the first one was in 2016, and we drew together a large number of authors to write on different aspects of the election, from political parties to the role of media to policy issues. And we did that again in 2019. And so we had the infrastructure to know that we could publish high quality research in a relatively short amount of time. And both of those books were also published by the University of Manitoba Press. And so we had a really good experience doing that, and we thought we could do this again this summer. And so those are kind of the origins of the book, of this book, trying to get out very timely analysis of where we're at in this pandemic. So the ebook focuses on wave one of the COVID-19 pandemic, and we define that wave one, at least in Manitoba, as being from March 2020 till August 2020. And to be sure, there will be a need for a full post-mortem that understands the pandemic as a whole. But Andrea and I also recognized fairly early on that we needed to stop and pause and reflect on wave one of this pandemic, because we know that the policy decisions and the non-decisions that are made in wave one actually lay the groundwork for where we are today, right, in wave two. And we know that waves will be different. Some will be, milder or gently rolling, and some will be quite striking. And given today's media announcement related to the number of deaths occurring today, we know that Manitoba is certainly not in a good place in relation to controlling this virus. And so we really wanted to stop and reflect on wave one, identify those policy lessons that we can learn for wave two and beyond. So the ebook is actually divided into 3 sections. The first section is a bit more of a global perspective in the sense that it doesn't look at specific issues per se, but it's more about setting the context for public policy and governance issues. So we have one chapter that explores the epidemiology of the pandemic. So this includes the nature of the virus, how it's transmitted, and how the healthcare system in Manitoba responded. And Dr. Josée Lavoie will be speaking to us about her findings tonight. We have another chapter that explores the broad governance capabilities. So looking at the leadership displayed by the province of Manitoba, looking at how the province of Manitoba made decisions throughout this crisis, and another chapter that explores the traditional media and the social media in providing information and also disinformation along the way about COVID-19. The second section looks at places across Manitoba to better understand the wide-ranging impacts of this virus on a variety of sectors and areas. So we have chapters written on the nonprofit sector, post-secondary educational institutions. We have a chapter written on organized labor, which Dr. Julie Gard will be presenting to us tonight. And of course, the impacts on the economy, which Dr. Fletcher Baragar will speak to. We also have chapters on the agricultural sector, the city of Winnipeg, and the northern region of Manitoba. The third and last section, titled Policy, Pandemics, and People, focuses on how vulnerable populations were impacted quite differently from government action, but also from government inaction. So we have chapters written on Indigenous peoples, women, persons with disabilities, immigrants and refugees, older adults, military personnel, families who are in need of income support during the pandemic, renters, individuals and families living without accessible and affordable homes, essential workers and understanding their mental health through this pandemic, and also the mental health of parents during the pandemic. We have other chapters that look at food distribution lines, recreation, how protests and pandemics intersect with one another, and the overall built environment. So looking at pandemics through an architectural lens and where we need to go from here for the next wave and the next pandemic. So I think the beauty of this book clearly does show the diversity of scholarship and practitioner knowledge across Manitoba. And I know Andrea and I are so incredibly proud of our authors for working really diligently over the spring and summer months. During a time that was challenging for most of us. So this book is certainly the result of their hard work, and Andrea and I were just pleased to be part of it. So on that note, I will turn the book launch over to Dr. Josée Lavoie.
Well, good evening, everybody. My task is to try to summarize the first wave of COVID-19 from a health policy perspective in 5 minutes. So this is going to go quick. I'm just going to leave a whole bunch of holes, which I hope the chapter will be able to address, and that I can address, hopefully, in question period. So I don't know about you in the audience, but for me, I knew nothing about COVID-19 until very early March. I had blissfully ignored what was going on in distant countries because it didn't relate to my work. I'm a professor in the Department of Community Health Science. I do a lot of work with the First Nation Health and Social Secretariat of the Assembly of Manitoba Chiefs in terms of research and partnerships. So we're working on renal health. I work with the Manitoba Inuit Association, and we're looking at the continuum of care for Inuit who come from the Kivalliq region, just north of us, for those who are not quite oriented in our geography. And Inuit have been coming to Manitoba for 50 years to access services in Manitoba, but until recently, they were not really on the policy landscape. They were not as visible. And so I was doing that work. And I was not part of university pandemic planning or provincial pandemic planning. And then, of course, on October 10, we started, on March 10th, we started hearing about cases in Manitoba. And it became very clear that the university was going to respond very quickly, and we were being asked to basically go home. And we all went home to start working from home on March the 13th. I came to COVID-19 research because I was asked by a colleague who provides services to First Nations and medical doctors saying, we need to know how many ventilators we're going to need. We need to predict how many critical case we're going to have so we can plan resources in First Nation communities. So that meant modeling. And I had never done modeling, never mind knowing about COVID. And so I was brought into doing that kind of work. And I dove into the research. And this is how I came to participate in this book. When I started my research at the end of March, there were, what was in the literature showed that we knew nothing about this virus. Absolutely nothing. We'd never had a pandemic with a coronavirus. There was very little that was published. What was published was not particularly dependable because it was based on a few cases here and there. It was really a patchwork of tiny bits of knowledges woven together into a patchwork of knowledge full of holes, effectively. So how did we respond as a province? Well, we responded with the best knowledge available at the moment where these decisions were being made. Testing was only for priority population. Initially, there were questions about whether if you tested somebody that had COVID but had no symptoms, whether the test would even come up as being positive. So the priority was really to test people that traveled. We reacted with closing the schools, with social distancing, which was in the context of a province where we had no social transmission or very little social transmission. That was a very prudent response. Some people might say it was an over response, but of course we didn't know. We didn't know how this would go, right? Food venues were closed at the end of March, which had a huge impact, of course, on those businesses, and but limited social transmission. So it probably delayed social transmission to some point. Was it an overreaction? Well, the only way to answer that question is to put it in a context of the knowledge at the time. And having read the literature, the 1,200 articles that were available, 12,000, sorry, articles that were available at the end of March, there was so little in there that we could go by, then being prudent made more sense. How did the policy response from wave 1 and from wave 2 that we're in? There's a number of things that we failed to learn, sadly. We knew that long-term care facilities in Manitoba were vulnerable. They were vulnerable across the country. And we had known that for decades. Families had told us that they were unhappy with the level of care, the level of services. We knew from research that there were some issues, and we knew that in Ontario and Quebec, this had been an issue. And yet we seem to have failed to learn from that. The success, if you want, of the first wave gave many of us, including me, a sense of false confidence, and gave us, we relaxed a little bit more than maybe we should have. And we are seeing the consequences. I mean, and I don't mean government in terms of our own behavior as citizens. And one aspect that was brought up by one of my colleagues is that what we could not predict is that love would play a big factor in the second wave, in the sense that distance from our loved ones, distance from elderly parents, grandparents, and the prolonged aspect of that would lead some of us to take chances and feel a little bit too confident that we had no transmission. And that promoted the transmission that we're seeing in the second wave. But there are some things that we did very well. One thing that we have done better than any other province in this country is that Manitoba Health, the federal government, the health authorities, First Nation organization, Métis organization, and Inuit organization came together very quickly in this pandemic and started meeting weekly to just discuss what was working, what was not working, and what could be improved. And I sat on that provincial table and saw immediate reaction by whichever stakeholder needed to react to improve the situation. So, for example, young moms being in isolation with their first baby for 14 days before being allowed to fly back to Nunavut. And their level of isolation was leading to some real anxieties and some real problem. And there were immediate service delivery responses to those challenges. So in conclusion, knowing that I only had 5 minutes, there are many things that I think we should have done better, but there are things that we did extremely well. And I invite you to read my chapter to find out more detail. Thank you so much for your time.
Hi. Karine, are you coming back to introduce the next speaker? Karine, you're still muted.
Sorry about that. I'm happy to do that. I believe actually Dr. Julie Gard is next speaking to us about the role of organized labor.
Okay, great. Sorry, I guess I should have just jumped in, but here I am. Okay, well, I want to thank Dr. Rounce and Dr. Levasseur for the hard work they've done and for including me in this very timely and I think very necessary project. So my chapter examines the Manitoba government's pandemic response with regard to organized labor. A focus on the government's treatment of unionized workers brings into clear focus the differences between provinces in regard to how well their policies kept infection and death rates low. Some provinces have clearly made containing the spread their top priority. And the spread in those provinces has been slow and fairly small. Provinces that traded off containment of the spread against other priorities have fared less well. As I show in my chapter, despite the Premier's claims to the contrary, made again today in a press conference, the Pallister government opted not to focus all its efforts on containing the virus. Rather, it attempted to trade that off against other priorities. One of those was its determination to reduce the provincial deficit, and that's dealt with in another chapter in this book. That's one of the promises that it made when they ran for election. But in addition to that, the government also pursued another priority, which was to reduce the size and scope of the public sector. Manitoba's high and rising viral spread can be seen as a result of these conflicting priorities. My evidence suggests that the government has done far better at reducing the size of the public sector and in cutting public sector spending than in controlling the spread of the pandemic. As other jurisdictions have found, austerity budgeting and cuts to the public sector are a poor response to the pandemic. On the contrary, an adequate response to the pandemic requires robust support to all the workers on whom we all depend and who keep the economy going. People like medical staff, utility workers, childcare workers, educators, educational support workers, such as the school bus drivers on strike since September, who keep the province working, safe, and healthy. That didn't happen here. The government did very little, virtually nothing really, to support private sector workers, although they constantly referred to the suffering of private sector workers to justify their attack on public sector workers. That's an attack on public sector workers, in fact, long predated the pandemic. In 2017, government passed the Public Services Sustainability Act, legislation that dictated that dictated a wage freeze and was designed, probably, it seems, to eviscerate rather than sustain the public sector. This year, it was ruled unconstitutional by a judge who called the legislation draconian. But rather than respect the court's decision, the government has doubled down on its illegal action by mandating a 2-year wage freeze across the public sector. It also forced layoffs of public sector workers, insisting that this was necessary to share the pain with those in the private sector. Nowhere did it ever explain how sharing the pain was going to help the private sector workers, and it certainly wasn't good for the economy. Private sector job losses were certainly bad for the economy, but so was freezing public sector wages and laying off public sector workers. Nursing shortages that resulted from the Pallister government's prior attempts to streamline the healthcare delivery system in 2017 were never addressed. Personal protective equipment that the government promised either didn't materialize, was inadequate, or in some cases turned out to be stale dated. Workers in all segments of the healthcare system, including my daughter, feel that they are at risk every day they go to work. But this government is nothing if not consistent. Since this book went to press, the government has done a number of things. They've called for volunteers to do the work of laid off healthcare workers. They've refused to even consider presumptive workers' compensation coverage. So workers' compensation coverage for workers who test positive after being exposed to COVID-19 on the job would actually assume that they had got that COVID-19 because of contagion at work and didn't need to prove where they had caught it. The labor movement has been pressing for this, and the government has refused to even discuss it. They have taken time out from dealing with the healthcare emergency in the province to introduce new labor legislation that erodes labor rights, creates obstacles to union certification, weakens collective bargaining, and eliminates mechanisms for resolving strikes. So while everybody is busy focusing on dealing with the pandemic, this government has put a lot of energy into developing bills that pursue a totally different goal, which is weakening workers' rights in the province to unionize and to stay unionized. They've increased the chances, the opportunities for workers to decertify, and even required a decertification vote in some situations. There's one helpful measure that the government has implemented, which is to make, just recently, to make it easier for Manitoba workers who test positive, who have to care for family members who test positive, to qualify for federal money through the Canada Recovery Sickness Benefit. But in the same case as with the top-up that the government provided to the emergency funding for workers during the earlier part of the pandemic, this was completely paid for. In the former case, they were cost shared. This one is completely paid for by federal money. So I would say since the beginning, the province's most spectacular success through the pandemic has been to reduce the cost and size of the province's public services, measures that have left Manitobans more vulnerable. Where they have failed, judging by rising numbers of positive tests and mortality, is in curtailing the effects of the virus. Now I'm done.
Great. Thank you so much, Julie, for that conversation about the role of organized labor during COVID-19. I would now like to ask Stewart Hill and Shirley Thompson to talk about their chapter that they co-wrote with Marlene Bonnycastle about COVID-19 and the inequities in Northern Manitoba.
Thank you very much. I'll start, Stewart, and then you, I'll leave lots of time for you. How's that? So the infrastructure deficit and the poverty creates a higher risk and higher vulnerability. And that's not matched by funding. In fact, it's the opposite. When we look at the numbers up until mid-October, 1/50th of the per capita rate is given to First Nations. So although the infrastructure, the housing crisis creates greater risks and impacts in intergenerational houses to put elders at risk and ill people, the food insecurity crisis, where there's, we did a recent poll of two remote communities, and found 100% food insecurity at 62% severe food insecurity in these communities for these 45 households sampled. As well, there's in every sector, in education, there's a lack of broadband, so they're losing out big there. Healthcare, without hospitals, extended cares, or ventilators, there's providing limited or no COVID treatment capacity. I learned today that how it works in the north, there's no hospitals and there has been no effort to create capacity in the north. That the doctor brought in COVID-19 to Wasagamak. Wasagamak had been hopefully has been a COVID-free community. It's a fly-in community that's about 15 minutes by boat from the airport. And so I'll let Stewart is an expert in water systems. So I'll let him cover that aspect as well as the transportation and the risk of mining. And Stewart?
Okay, Okay, I can briefly talk about my dissertation and what it's kind of showed. And I worked with my community of God's Lake First Nation, and I looked at what would be the best way to address the water shortage or the lack of water services to our First Nation. And what it comes down to is, for me anyway, is governance. Our communities need to be empowered. As you know, that in my examination of my community, I've had to examine the power structure of Canada and our relationship to Canada, and how that dysfunctional relationship, that dependency relationship that is in place in Canada right now between First Nations and the colonial government. And it stems from the first Constitution of Canada, which was passed in 1876, which in effect, even though it doesn't really state that, in effect what it did was it made us wards of the state. And then to capture that section of the first Constitution, section 9124. In 1876, they passed the first ever Indian Act of this country, the history of this country, and then there was all kinds of restrictions on what we could do as peoples, and what our powers, and to take care of ourselves. But basically, what they did was we became dependent upon the system, even though it wasn't until about the 1960s, which is not that long ago, that you see our people starting to assert their rights and starting to say, you know what, this is not working. This system is not working. And then you have not until 1982 that you have the repatriation of the Constitution, and we're all aware of Section 35. The other question that comes into being in relation to that is Section 36 of the Constitution. Section 36C, I believe, that says that we have, the government is responsible for providing to all its citizens the level of services that would enable a good livelihood or a good way of life. But in some cases, like especially the remote northern communities, those communities would fail that test, because they're on a combined system of pipe running water, and then they've been using cisterns for wastewater and water delivery for decades. Now, are those cisterns meant to be used for decades? And we're sort of questioning that now. And we're thinking that no, maybe not. But the overall problem is, if what this virus is showing us is how ill prepared we are to carry out your constitutional responsibilities and your fiduciary responsibilities to First Nations with respect to health, with respect to the economy, the culture, the social systems, the social problems, all that. And we didn't ask for that system. We were never asked if we wanted to be in your constitution in 1867. And we certainly did not ask for the Indian Act, which is still in power today. And also the Constitution Act 1982, even though it protects us in Section 35, again, all these things have unilateral interpretation. And what we're saying today is, we need to change the system. We need to empower First Nations. We need to come up with a different way of living together in this country we call Canada. And I think we're running out of time, but I'll hand it back to Shirley.
So thank you, Stewart. That was so key. So I just want to note, as Stewart noted, that cisterns have ran out continuously, leaving houses without water during COVID. And some communities have had broken water systems for weeks. So they've even have at the health center no running water. So in First Nations communities in particular, as Stewart was mentioning, the water systems are vulnerable, all the systems are vulnerable. And with the fact that mining companies, maybe you want to speak to this a little bit, Stewart, is mining companies and hydro companies have been considered essential workers and brought in, which has brought in risks as well, when really being close by to First Nations, that risk is undue, and these are not essential services. So I think we have to rethink that policy, as well as many others, right? Is adequate funding and many other issues, and the cisterns being absolutely unacceptable, except for in emergency situations. Thanks.
Is that our time?
If you want, please add something, because I know you have some great points.
Oh, okay. Yeah, that's that's that relationship I talk about, that dysfunctional relationship. And when you have resource companies coming in, or even infrastructure companies coming into our territories are very much a part of the way our communities function. They're part of they're part of our governance, especially when it comes to our culture and our social structures. People come in from the outside and they say, "Oh, that way of life is dying. Oh, that way of life is gone. It's going to go by the way of the buffalo, or by the way of what we've seen in the past." You know what? That is a very mistaken viewpoint, because we have to realize that we are in evolution. It's not over. We're still living with this colonial dynamic that we've created. And we have a chance now to start looking at it and say, you know what, let's change this. Let's change it. Let's empower the people to determine their own destiny and say, you know what, there's a better way to do this. And I believe that it will happen. It's not a question of if, it's a question of when, according to what my elders have told me. It's not over. And probably what I've been told by the elders is that we are the 5th generation. It's not until our children's time that we'll see partial self-government. And then in our grandchildren's times, that's when we'll see full self-government. So we'll not live to see it. But it will happen. And we need to start thinking about that. We are the foundation builders. We are the ones that build that build that foundation. And with this COVID pandemic, we have a very serious problem to think about. You know, if we're going to continue on with this dependent relationship, if Canada is being hit hard, how much do you think it's going to hit the First Nations that are dependent on that system? It's going to be double, maybe triple the effect. You know, that's how hard it is. And right now, like maybe you watched the news tonight, Shamattawa is having a very hard time right now. They're calling in the rapid response teams and they're calling in the Army. You had the Army go into the OCN. And we need to really think about, you know, how we can empower the people and First Nations. We need to change the laws of this country as a first step. Okay, thank you.
Thank you so much, Stewart and Shirley, for sharing that with us and shedding a light on the colonial infrastructure and institutions that are playing out during COVID. So our next speaker was scheduled to be Dr. Fletcher Baragar, talking to us about the economic impact of COVID-19 and policy responses. But unfortunately, we have been experiencing some internet challenges, and unfortunately, his internet keeps dropping off. So unfortunately, he's not on right now. So Ariel, maybe we'll go to questions and answers, or Andrea, do you want to jump in there?
So I have some closing remarks to make, so it's too early for closing remarks. So maybe what we'll do is go to questions and answers, but also if there are any of the contributors, because I know that there are a number of contributors here as well, if one of the contributors wants to jump in with a question or a comment or a teaser for their chapter, I think we could also, if you add that into the question and answer, I think that we could hear from a few more people as well.
If you want, I could start by reading there is a question in the Q&A, and I think it's a good one. I think it allows everyone to jump in. So it's from Gail Hallis, and it says, is there a common theme or a key lesson learned from across all of the analysis that will prepare us for future pandemics? So does anybody want to jump in and answer a part of that?
I could do a little bit. It seems to me that, you know, when you look at like my focus, being on organized labor, suggests that this government, you know, constantly claimed that its major priority was dealing with the pandemic, but it was very clear that that was not the case. And we hear about, you know, the health concerns of, you know, Indigenous people in more remote communities. And it's also clear that that was not the government's priority when it came to dealing with those communities. So I don't know, you know, I'm sure there are other contributors who would have other things to say about this, and maybe not all of them would be quite so negative as mine, but I think as we look around and we see, you know, the numbers rising rapidly. I mean, some of us have been you know, sort of being as careful as possible, hardly going out since March, and other people, you know, and the government is, you know, continues to do like the daily scold, which is clearly not a policy. But I think the inconsistency of policy and, you know, the absence of anything concrete leaves us at a real disadvantage with regard to other jurisdictions.
If I can add to that, Julie, and I'm afraid I'm not going to be any more positive than your comment, but the way to move forward is to there has to be social cohesion, social solidarity, and abrasive comments, and I'm thinking about the Minister of Health, reaction to medical doctors coming out, or medical healthcare professionals coming out and saying, you need to act more, we need more closures. And this was at the end of September. to try to prevent where we are. And that very abrasive reaction that we got from government did not help at all. And so what has not happened is that sense of appeal to social solidarity from upper up. And as a result of it, we're seeing the disintegration of those systems, and we're seeing resistance, and we're seeing protest, and so on and so forth, and a healthcare profession that is very tired and feel unheard. That is not a good situation to be in. So I think that the issue of solidarity and coming together as a cohesive force to look after, to react together in the pandemic is very important. And of course, leaving behind First Nation, that's always going to be an issue, isn't it? That we can't, unless there's equity across our societies, we can't really address a pandemic.
Does anybody else want to jump in?
I can maybe pop.
Oh, Stewart, you're muted.
Oops, sorry. One of the things that on the first wave, one of the things that that was kind of lacking was the enforcement of banned bylaws and banned council resolutions. There was a vacuum there. The RCMP said, you know, we can't enforce your banned council resolutions. We can't enforce your banned bylaws under the Indian Act. And then all of a sudden it came to, well, what about the public health order? Can you enforce that on reserved lands? So it became a back and forth between province and provincial and federal powers. But one thing that really became clear to me at that time, and this was the first wave, is that you are nowhere near ready. The RCMP are nowhere near ready to address a pandemic on reserves and for reserve communities. Now, in what areas of programs and services can I say that? That's an interesting question. And I just want to say that, like, we're not ready. Like, the first wave showed us that. This second wave is showing us even more. What about the third and fourth and other pandemics? And I think this needs to be addressed nationally in Canada. Thank you.
All right, I'm going to move to the next question unless anyone else wants to jump in.
I'll just reiterate the fact that these communities, First Nation communities, many are remote. So they're fly-in communities only. Healthcare flies in and out. There's no broadband. But this idea that they have to get on a plane for healthcare, and that brings both the healthcare people with COVID-19, and in some cases that has already occurred in remote communities, but also people coming back. You know, planes do not provide are a source of concern for infection. So there's many concerns that that because of poverty, because of the lack of services, because of the lack of infrastructure, there's going to be worse impacts, but also because of the health vulnerabilities. So as well, there's lots of higher levels of diabetes, higher levels of TB, tuberculosis. So tuberculosis is 50 times higher in on-reserve First Nation communities. And that's because of the poor infrastructure and the poor healthcare. And just think, COVID-19 is so much more contagious than tuberculosis. So 50 times higher. I worry what the result is going to be. And we're already seeing it in the positivity rates, that they're, you know, the First Nations chiefs have done such a great job having lockdown. You know, it's at such a cost to the community members being stuck in their houses, of having, you know, no economic activity going. And yet now the positivity rate is 21%, or at least it was the 5-day positivity rate compared to the 14.5. So much higher.
Thank you so much for that, Shirley. Okay, so moving on to the next question from Leslie Tucker. What is José's response to the notion of citizens volunteering to alleviate healthcare worker fatigue?
Well, that's an interesting question. Why are healthcare workers fatigued? And why is there not relief? Why is there not sufficient healthcare workers to do the work of healthcare workers? Why are volunteers being asked to do union work? I can carry on, but I don't have a lot of warm feeling for that approach. I can appreciate that we're in a time of crisis and some decisions were made and now here we are. So we have to deal with the reality of decisions that were made in the past. At the same time, we don't have the excuse that Quebec and Ontario and BC have, right? They jumped right into community transmission right off the bat, and we're dealing with a very aggressive first wave. We don't have that excuse. We had 6 months to get organized for the wave that we're in. And so what did we do is the question. So I'll leave it as that. Others may surely want to comment.
Let me just echo what Josée says. So healthcare workers in all kinds of other areas are being seconded recently to work in personal care homes and acute care facilities and so on, which suggests that, you know, the cutbacks to the healthcare system that were instituted in 2016 and maybe even earlier, I'm not quite sure about the dates, are coming home to roost now. Now is when we need these workers. I think it's very problematic to put volunteers in place of skilled workers. I think it puts them at risk, and it puts the population at risk to have volunteers do this. People who are paid are, there are regulations that govern people's behavior at work. People have protocols that they know how to follow. You put, we had the premier dispute recently, the testimony of someone who was doing volunteer contact tracing. And he talked about the work that he had done, and the premier was asked, and he said, no, we have no volunteer contact tracers. I think one of the problems here is not just that we have volunteers, but we don't even know who to trust. That the trust of this government has been eroded by inconsistent messaging, which doesn't always seem to reflect the realities that we see before us. And I think that's a serious problem.
There's another question from Leslie that actually is for you, Julie. Does the author anticipate further draconian austerity and anti-union measures in the next few months?
We have no reason to think otherwise. A significant number, we don't actually know how many, of public sector unions have received mandate letters from, what's his name, Scott Fielding, basically instructing them that it would be a very, very good idea if they were to offer 0% increase on contracts that have been at 0% in most cases since 2016, including those at the University of Manitoba. So this is no longer, they feel this is no longer illegal. They're not going to be taken to court on this one because it's just a strong suggestion. But I think most public sector employers know that there's going to be repercussions if they offer their workers more than 0. So these are now a whole echelon of public sector workers, not just professors, but people who are considerably less well paid than we are, who have had no increase since 2016. So I think the government is on a campaign to undermine the public sector. So I can't see anything positive coming out of this particular government. I think they're quite determined. We saw that when we were in bargaining with the government recently. well, we weren't bargaining with the government, my mistake. We were actually bargaining with the university. We just felt like we were bargaining with the government because that's where the orders were coming from. So I think this is a serious problem. The government is determined to slay the deficit, although it has if Fletcher were able to speak, and I'm sorry that he's not able to stay connected, but what we know is that the claims that the Premier made about the high and unsustainable deficit were wildly exaggerated. He misunderstood the data, apparently. Slaying the deficit is actually, by all accounts, not the most important priority in a health crisis. The most important priority is keeping people healthy and in terms of the economy, providing some stimulus funding. So actually paying people to work, to do work that needs to be done is a better economic strategy. And I think the government has shown that it's not going to do that either. So I have no positive thoughts about what's going forward with this government. I wish I did. I wish we could see some light at the end of the tunnel. It actually looks bad. Oh, apparently Fletcher's back. Okay, let's hear Fletcher on the economy because I'm not the economist.
Fletcher? Fletcher, I've asked you to unmute. Are you there?
Yes, hello.
Hello.
I'm here.
Hey.
Thank you for your patience and sorry for the disruptions.
All right. Well, do you mind giving the audio-only version of your presentation?
I don't mind. Do you think it's still fitting? I did miss some chunks of what other people presented, and so there is the danger of some overlap or repetition, but I can proceed if you wish.
Please do.
All right, thanks very much. Then I'll do that. Well, my chapter was really about sort of the economic impact, more in the macro sense of the economic impact, although there's some sectoral details, and then a bit about the policy response, primarily the response at the provincial level, but also to put that in the context in conjunction with the response at the federal level. Just a reminder, and this has been touched on by some of the other presenters as well, but this crisis, this first wave and the economic crisis that accompanied it hit really in the middle of March, and it hit with a wallop. Certainly economies, Canadian, Manitoba economies are no strangers to phenomena such as recessions, and we've even had depressions at various times, obviously the serious one back in the 1930s. But we hadn't seen anything of this sort where there is this precipitous collapse of both the demand side and the supply side of the economy in a period, not in a period of months or quarters, but really in a period of days. So that in early March, the Manitoba economy is going around with a 5% unemployment, which is enviable unemployment rate, an enviable rate with respect to Canada at that time. And 6-7 weeks later, we're looking at 11.4% unemployment, something like 90,000 jobs lost, and that's 13% of the labor force. And that's just jobs lost. Never mind those who are on reduced work weeks, etc. So the hit was really hard, and it was really intense, and for sure it wasn't spread evenly across the economy. We know, for example, certain sectors like the retail sector, and especially food and accommodation, passenger air transport, for example, and also workers in particular, lower wage workers were especially vulnerable and especially hard hit. So the economy really collapsed at sort of an unprecedented speed and fashion for that collapse happened really quickly, and it sort of tumbled for roughly 6 weeks. But then it sort of hit the bottom of sorts, and in the beginning of May, with the luckily the numbers were encouraging on the health front, and as a result, there was sort of a gradual relaxing and sort of an attempt to sort of move back to a more complete economic activity, phase 1 starting in May the 4th, and then phase 2 and phase 3 coming in June. So what we've seen is a really sharp decrease, about a 6-week period of sort of tumbling or hitting the bottom, and then a bounce back, which was substantial in the first month or two and continued really right up to about mid-September. But that continuation was, with each progressive month, was less and less and less. And it should be pointed out that even by September, so we're looking at now 6 months after the onset of the crisis, we still were not at employment levels or output levels that were equivalent to where we were in February of this year. So we're close. We're about 2% below as of early October, about where we were in February. But so a big gap, a big drop, and then a bounce back and a gradual attempt to sort of climb back to where we were. So under those circumstances, this twin crisis of sort of a health crisis and an economic crisis suddenly appearing in a really stark way creates a number of challenges for economic policy, and certainly at the federal and provincial level. For the province, I mean, the policy challenge is really threefold. On the one hand, it's important to make sure that you've got the resources, including the financial resources, and make those available to the healthcare sector and the frontline workers. That's got to be first and foremost. Then the second thing is to try to provide some macroeconomic stability, and if you're optimistic, then perhaps some encouragement for a longer-term recovery. And then the third is to provide assistance for those sectors of the economy or those households and businesses that are being hit directly by the crisis and need various forms of income support and financial support. And the ideal thing would be to try to develop a set or a package of policies that would try to meet all three of these objectives simultaneously. And if not, then maybe at least define policies that can complement each other. Unfortunately, I should say that at the federal level, the federal government stepped in pretty quickly, and with policies like the Canadian Emergency Response Benefit, that was announced at the end of March, and so they moved in. Obviously, it was quick. The policies weren't perfect. There were holes. There were problems. But the attempt was to try to get resources out and income out and support out and encouragement out to Canadians, workers, businesses across the country. At the provincial level, the province initially has tried to find resources for the healthcare sector and the frontline workers, but they did so by trying to reallocate within the provincial context. So basically taking resources away from other sectors or financial resources from other workers and trying to target those or amass those for the healthcare sector. And so that meets the first objective, but it doesn't do anything to the second and third objectives of macroeconomic stabilization. And in a sense, you're sort of robbing Peter to pay Paul, and in fact, it's worse in sort of just a neutral effect of a loss in one sector and a gain in another sector, in that it creates conditions of uncertainty, of fear, of concern about people's jobs, about people's incomes, who's going to be hit next. And so in an economic crisis where there's an enormous need to provide stability and measures of confidence and to ensure that there's sort of continual payment flows and spending flows and income flows, these sorts of measures disrupted a lot of that, and I think further impaired confidence in the economy. And the range of sort of federal income support programs for various types of workers or types of businesses, which came out in March and April, really didn't have any provincial counterpart as well. So the province was slow to move on that front. And then when it did start moving towards the end of April and then into May and June, it announced a certain amount of money in many cases, but the restrictions were so stringent or so selective that the uptake on numbers of people applying and gaining eligibility for these programs was very limited. So the money was there, but a lot of it just wasn't drawn upon, and that's still been the case as we sort of moved in out of the summer and into the fall. So just to sort of try to summarize that, I would argue that on the economic policy level, at the provincial level, the province could have done better. Allocating resources to the healthcare sector is good, but it shouldn't have come from other sectors. There's a rainy day fund, and if I don't know that the conditions in March and April constituted conditions in which you'd want to drain that fund first before taking funds from somewhere else in the economy, then I don't know what the rainy day fund would possibly be used for. Secondly, I think the other thing that's really important to mention is that at the national level, the central bank moved quickly to lower interest rates. Interest rates were already pretty low, but they cut the basic overnight federal funds rate right down to 0.25%, which is a historic low level. That just means that it's easier, that changes the whole structure of interest rates. It makes it easier for different levels of government to borrow. And that includes the federal government and certainly also includes provincial governments. And the provincial government, I think, had the opportunity to immediately make use of lower and more favorable borrowing rates to have the funds in place to provide the income supports for sectors of the economy, some businesses, and certainly those households that were losing their more traditional, usual supports of income. And that was an opportunity that the government felt it was reluctant to move on. Now, obviously, it's been forced to move on that because its revenues have started to dry up quite significantly as well. But there was a lot more scope in terms of borrowing options for the province, using the rainy day fund to provide the financing that was needed for a more emphatic move with respect to economic stability, macroeconomic stability, and income support. I'll leave it there, but there's certainly more details in the chapter and in the other chapters of the book, and I'm certainly available for comments or questions.
Well, thank you so much, Fletcher. We're going to leave your mic on, so if you want to jump in any of the questions going forward, please feel free.
Okay.
All right, so I'm just going to move on to some of the other questions on our list. We've got 4 or 5. Okay, so Diane Dreger, who's one of the contributors, asks, what has the impact of COVID-19 been on First Nations peoples with disabilities? Shirley or Stewart, do you want to?
Yeah, I can comment on that. Hang on, it's gonna. Okay, I can comment on that. From what I heard in the first wave was that you know, those people that have chronic illnesses, they have to travel out of the community, and it's deemed essential travel, especially the remote northern communities. And one of the responses to the pandemic was to maybe bring out those people, those with chronic conditions, and place them somewhere in the city. And it was very serious because some of the people were refusing. And what that means is certain death. So it was very, very serious. If a person decided to not come south for their safety and their well-being, and then, you know, there were people that actually refused to come down south, to be born or to be placed or in an institution or wherever they wanted to stay home. I know some people assume that, you know, people want to come down south, but that need to be at home. This is our home. This is our homeland. This is where we grew up. it's not that easy to leave your home and come to an institution or be placed in a foreign environment. So in that way, like it was a very serious situation. And then in this second wave, I heard in Norrie House that those people that left the community to go to Thompson to get their for dialysis and to get treated, they had to stay at the YWCA in Thompson because they weren't allowed in. They weren't allowed back into the community. So the impact of the pandemic is very severe upon the chronic and the handicapped, especially within First Nations that depend upon outside services. They have to leave the community to access services. The services are not available, especially like in the small communities, and that they don't have the services there. So they have no choice but to leave. And it also increases the exposure, the potential for exposure when they come down south or to the urban centers. So definitely the impact is great. Thank you.
All right, thank you so much, Stewart. Yeah, that was thank you for your insight. So there's a question from Brian Peeler, who says, is there a way to know how much money that came from the federal government to the provinces was actually put towards COVID by the provincial government? Does anybody want to respond to that?
This is Fletcher. I don't actually have all those numbers or those answers yet. I think there is information coming out in bits and pieces, but I wouldn't hazard a guess on that yet.
So that's still coming.
And maybe if I can just jump in, Fletcher, I agree. One of the things that we've seen is access to information requests to the provincial government in the last couple of months, asking for exactly those numbers. And the requests that I've seen, or the responses to the requests that I've seen, have been turned down because they say that information doesn't exist in the format in which it's been requested. So this isn't completely unusual in terms of transfer payments and funds that come from the federal government. There isn't often a direct correlation, and it's frankly in the provincial government's best interest not to, not to talk too openly about where that goes or where it doesn't go. But you can kind of think of it flowing into sort of a big pot of money and then being allocated from there. So I will, like Fletcher, I'm sure, be watching for evidence of where those funds have come from and where they're going.
All right. We have another question. We have a question here from Ashlyn Hagland. She wants to know if anyone can speak to the challenge of democracy and transparency more generally. So the Manitoba government reduced the number of days that the legislature would sit, the time for debate of tabled legislation, etc. Premier continues to suggest anything short of agreement is a distraction, and the legislature will be on recess from December 3rd until March. Does anybody have any comments to make on that question?
I can give this a shot, but maybe Andrea, my co-editor, can jump in here too, because this is actually a topic we have been having conversations about. We know that when the PC government was elected into office in 2016, one of its core features was proactive disclosure. And this government, early on certainly did undertake a number of initiatives to disclose information more proactively, setting up a website, releasing the mandate letters that the Premier sends to cabinet ministers. So we as citizens can read what ministers are expected to do from Premier Brian Pallister. So certainly from that perspective, transparency has been on the radar of this government. That said, however, the question, does become, now that we're in a pandemic, it is reasonable to expect that the legislatures might not meet as often or meet differently in different formats like we're doing tonight. Normally, we would love to do this book launch in person, but this is where we're at. So we can certainly appreciate that. But, given the last question about, the transfer of money from the federal government to the province, coupled with the lack of evidence to help inform, where is the provincial government spending money? Where is it allocating resources to certain jurisdictions, certain policy areas? That hasn't been made very clear. And I think I keep thinking back to one of the things that really inspired me as an academic is to actually see journalists going fairly consistently asking these kinds of questions and the kind of reporting that we've been seeing them do. So we don't have, I would argue, as much transparency, but in a crisis, this isn't entirely unusual. But we would expect there to be some planning to start releasing some of this, and that's the part that I'm not seeing. But Andrea, do you have anything to add?
I would agree with everything that you have just said. One thing that I would just add is that, we're in a very interesting circumstance because government is obviously dealing with an ongoing emergency, right? Which is an unusual circumstance. It requires them to do things differently than they usually do things. It requires different things of public servants, but it really does require different things of elected officials. But at the same time, there's a whole bunch of stuff that just continues on, right? The activities of government, the work of government continues. They continue to deliver programs and to provide services. And so there are, sort of some regularized or some regular things that governments are doing at the same time. So, and some of these things sort of, there's a tension between these things. And I think that's partly what we're seeing where, and to be fair, we're probably also seeing a government that is very ideologically focused, that is taking the chance to get things done that they think really need to be done. And so, I second what Karen said in that we need to, as citizens, we really need to start seeing more transparency. We need to start seeing, where things are being spent, what decisions are being made, because we're not seeing the level of transparency that even in an emergency that we should expect to see from government.
Yeah. All right. So my next question from Delaney, who I believe is one of the contributors as well, would someone be able to speak to the lack of childcare in government response during the first wave and the disproportionate caregiving role placed on women when schools and daycares were closed suddenly? Is anybody?
So that's a great question, Delaney. And I think that Susan Prentice is with us and she wrote on childcare. So I wonder if we might ask Susan to address that. Oh, she's here. So Ariel, if you can make your magic happen.
I will make my magic happen. Fletcher, do you want to, you were on for a second, Susan Prentice. Oh, there we go. Okay, give me 1 second.
No, I'm good. Thanks.
Okay, Susan, are you there?
There.
Okay, go ahead, please, if you'd like.
Well, hi. Thanks for asking about childcare. Manitoba didn't do very well in national perspective when it came to dealing with childcare. And we weren't very good even pre-COVID. So it's been a very tough haul for parents of young children in Manitoba. And it doesn't look like the province has learned very many lessons because currently on the policy agenda are some pretty retrograde moves. The one thing I will say is that the importance of childcare to women, to families, to children, to the economy is evident in a whole new way to most people who are watching thoughtfully. So I do take that as at least something positive to try to pull from this debacle.
Yeah, and it's interesting because it looks like the schools are maybe shutting down again soon. So it may become an issue very quickly again.
The public health is still pretty unclear about the role of children in transmission. What does seem to be emerging, although it's all still very much in flux, is that children seem to be largely asymptomatic carriers. And so there are a number of public health questions about whether or not schools and childcare need to be closed down as a part of that sort of circuit break for COVID transmission. It's right now still really an open question. That the costs to families when school and childcare closes are really high, and so I think it would be good to have more science on this.
Thank you so much, Susan. That was great.
Thank you.
Now we have a question from Judy Hodge. Now the only issue is that Bill Ashton, who is the person that addressed this in anthology, is not in the call. And so I think, Judy, I think we're going to skip your question. Thank you so much for submitting it. And so I think what we're going to do, oh, and sorry, Shirley Thompson, who was one of our panelists, asked if all panelists could, why don't we finish with all panelists giving their #1 policy recommendation? Does everybody feel comfortable doing that? That was a suggestion from Shirley Thompson. So did people want to come on and do that?
Sure.
Okay. Fletcher, do you want to go first?
Okay, well, I think we're in a second wave now, a similar shutdown, and it looks like the impact of this wave is going to possibly exceed that of the first wave. So I think the top priority has to be make sure that there's enough financial resources needed for the healthcare sector and frontline workers. And then secondly, focus at this time on sustaining incomes and employment. And everything you can do to help that, that means this is not the time to restructure the civil service. This is not the time to pair the civil service or worry about the budget and the bottom line. When you're in the midst of a crisis and when there's a shutdown across the economy and the flow of incomes and spending and production are attenuated, this is when you need to have massive public support. And in that sense, the provincial and federal governments need to work together, and everything and anything they can provide is good. In the long term, you could think about restructuring, you could think about altering the tax system and other ways to deal with the bottom line. But
President Trump's charge that there has
that would be it for now.
Electoral fraud.
Anyone else want to add?
I'll just weigh in because, I mean, what I will say is not much different from what Fletcher just said. I think he's exactly right. You know, stimulus funding is best done by, you know, transferring money to individuals, workers, people who not only, you know, make the economy run, but also fund, like, you know, do all the things that we need to have done. So I guess it's not a positive policy suggestion, I guess, but I think the government should back off what it's doing. Its general attack on workers, I think, is completely unproductive. You know, it somehow imagines that we can transform much of the public sector to hand it over to private sector actors. And that, I think, includes post-secondary education, childcare, and all kinds of other things. They want to see a diminution of the public sector. And that's, I think it's a terrible idea. Manitoba has always had a slightly larger public sector than some other provinces. They're a critical part of the economy. So the attack on workers, the attack on both public and private sector workers, the failure to support workers is a serious, serious problem in the way that this province is dealing with the pandemic. Healthcare workers come to mind. The healthcare workers who are underpaid, overworked, and collapsing, leading to unnecessary deaths in care homes and other places. I think it's a disgrace for this province that is completely unnecessary. It can be corrected, and the government needs to address that by providing supports to those workers.
Thank you, Julie. Anyone else want to do their closing policy suggestion?
Yeah. Actually, I fully concur with both Julie and Fletcher. What we've heard from the medical community is that there's questioning about Dr. Rosson's budget and the ability to deploy resources for contact tracing in an efficient way. So we've heard about cases where families are contacted 10 days after they tested positive to do the contact tracing. Well, that's just unacceptable. Whether that's anecdotal or whether that's the norm is impossible to know, because the flow of information it's been filtrated, as you know, on all these updates. And so we need to call on solidarity, and Julie said it very well, of the public sector, but there has to be some resourcing going into those key issues of contact tracing in order to contain this epidemic. And we can't do it by alienating the workforce that is there dedicating themselves and putting themselves at risk.
Anyone else want to chime in?
Okay, I can maybe make a comment about that. I think there needs to be an examination of how this pandemic, like in the context of a pandemic, there needs to be, with respect to First Nations, there needs to be what plans are in place for the immediate and the medium and the long term. So that it's already in place before the pandemic hits. It's you've seen what I call a vacuum of actions occurring in a struggle between provincial governments and federal governments, and who has authority and who has jurisdiction. And all that shouldn't be happening, first of all. And that these examinations of immediate, medium, and long term should be across all sectors, because it affects everything from food security, law enforcement, healthcare delivery. I know healthcare delivery is going to be very, very important. It's going to be a very major consideration, but it affects all programs and services on reserve. So I think you need to look at that all those. What do you do in the immediate term? What do you do in the medium term and in the long term? And they all connect. They're not separate. Okay? And I think that would be my number one recommendation. Thank you.
Thank you so much. All right. Oh,
Can I just add?
yes.
Thank you, everyone. Great recommendations and fabulous, Stewart. There are such systemic barriers for First Nations, and it really played out. I remember 100 million went to the community food centers. So they were to donate it to other places. Could they get it to First Nations? It had to go through a qualified donees. Every single city, village, a municipality is automatically a qualified donee. So they get charitable status. But it couldn't go to First Nations because they're not automatically qualified donees, and most have never applied because it was very difficult until really very recently. So both the federal government is giving hardly any, much less to First Nations, and then it's prohibiting charities from giving it. So it results in a complete vacuum and lesser amounts. So this overt bias has to be looked at, and the federal government has to stop making the decisions for Indigenous people. It has to place those, it has to come from Indigenous leaders, and the money has to flow to Indigenous-led organizations to prevent these kind of things from happening. And the capacity building, something that's very problematic is that any education on First Nation reserves is not funded, publicly funded. Whereas in, international students, if you come to our university, everyone's publicly funded, right? But not when that education is on reserve for post-secondary. So there's very little happening around post-secondary, and that's what we need to build local education systems, but for nurses, to build the capacities for nurses, for healthcare workers, for doctors, so that they're not flying in disease and people aren't flying out or not flying out, as Stewart said, because they don't want to leave their communities. There was so many unmet health needs, and you're seeing that in 1 in 10 people in First Nations reserves before COVID. And so much has to be done to remove the different outcomes, the inequitable outcomes, and the inequitable funding. Thank you.
Thank you. All right, so we're going to close this event. Andrea Rounce is going to come on and she's going to give some closing comments. We thank you so much for all of this lovely discussion and for all of your thoughts. So please welcome Andrea Rounce.
Thanks so much, Ariel. And thank you so much to all of the panelists who were presenting tonight and who were answering questions. And thank you all for your great questions. You've given us a lot to talk about and a lot to think about. So I just have a few closing remarks. I mean, we all know now that the overall theme of this book is that there are areas of success for governments, both provincial and federal, during this first wave of the pandemic. But we have identified, our presenters have identified significant concerns about how governments have responded to the pandemic, particularly as we got closer to the end of the first wave, when it was clear that people were raising questions of enforcement, Premier Pallister's leadership, supports for frontline healthcare workers and others who were deemed essential, and what that second wave was really going to bring for Manitoba. So this book has allowed disparate voices, people from across the province addressing issues affecting all Manitobans, to really share evidence, and that is in terms of numbers, but also stories that would help us to inform people about what was happening during the first wave and why it matters for us now that we're well entrenched into a second wave. This isn't a traditional academic book, and we are immensely grateful to the University of Manitoba Press for them going along on this journey with us, and being able to make this book free so that anyone who wants to read more is able to do so. And this is due in large part to support from the University of Manitoba Press, from the Dean of Arts at the University of Manitoba, the Department of Political Studies, and also from the University of Manitoba Library System, which was a surprise to us and a wonderful contributor to the overall book. We are deeply indebted as editors to David Carr and to Glenn Bergen and to their team at the University of Manitoba Press, in large part because of their belief in the importance of this book. And they allowed us to really bring together people who had different perspectives, different experiences, and to really address this first wave of COVID-19. The willingness to make it available for free really underscores for us the commitment that this press and that the University of Manitoba makes to sharing information and discussion and debate more widely than within the university community itself. And we must absolutely thank the authors, because without you all, this would not have existed as a project. And Karine said at the beginning that we were, as editors, we were kind of along for the ride, and that's kind of how we felt. That there really were, that you all had such amazing ideas, did such a strong research, and had so much to say and so many great recommendations to make. For governments and for others to really consider going forward. So I wanted to also thank Ariel for organizing us tonight. We were, in the COVID world, we would normally like to do this in person. We'd have cookies and there'd be some coffee. And so, you know, the drawback is no cookies and coffee, but the upside is that we have a whole bunch of people at this event tonight that probably wouldn't have been able to join us otherwise. And so I thank everyone who was able to join us tonight as well. The last thing I just wanted to say is that there have been questions already about whether or not there will be another volume. And so what are we going to do to address the second wave? And I will just say that Karen and I are giving it some thought, and I know we've already heard from many of the contributors that they would be interested in tackling, you know, COVID part 2 once we make it through this second wave of the pandemic into whatever comes next. And we'll certainly, you know, be thinking about that, and we'll look forward to hearing from contributors about whether that's something that they would be interested in participating in as well. So I think I have one last thank you, and that is to Shannon Furness and Laura Abragamova, who were outstanding student assistants that were on top of things, who were able to, you know, get things done at the very last minute, who were able to jump on things that we needed done very quickly. And that is, they were a fantastic resource and fantastic contributors. So thank you so much to them. So I'll leave it at that. Again, thank you for joining us tonight. And we look forward to talking more about COVID-19 and government's response in the future. Thanks.
All right, so if everyone wants to come on and wave goodbye, we will take our leave. We can do our queenly waves if we want. Thanks so much, everyone.
Thank you.
Good.
Good night.
Good night.
Good night.
Have a good
Good
rest
night.
of your evening. Good night. All right, I'm going to close this here. Thank you so much. Good night.